Insight therapies. So, insight therapies attempt to change people on the inside, changing the way they think and feel. These are sometimes called think therapies. These therapies share the assumption that distressed persons need to develop an understanding of the disordered thoughts, emotions, and motives that underlie their mental capabilities. So there's three main types. We have psychodynamic, humanistic, and cognitive. First, let's talk about psychoanalysis. So obviously, as we've talked about all year, this is founded by Sigmund Freud. The root of all problems, according to psychoanalysis, is in the unconscious conflict. All right, that's key. We've talked about that. Key words for each perspective or approach. Obviously, with psychoanalysis, it's all about unconscious conflicts. As we mentioned during the personality unit, right? Also, there's an imbalance in the id, ego, and superego. So we talked about, the id is your basic desires, your superego is your morality, your ego is the conscious decisions between the two, the balance, right? And when there's an imbalance, that's when we have um, mental disorders. Next, conscious insight can resolve conflict. So it's all about looking within. Special therapy techniques may be used. Free association that we talked about. If you remember, that's where you kind of lay on your back as the therapist asks you, what's on your mind, and that's where you just say whatever on your mind, no matter how trivial or how stupid you might think it is. You just say whatever on your mind, and then the therapist will analyze that. Dream interpretation. We talked about that during the consciousness unit, right? So they believed in interpreting dreams and interpretation of resistance, right? From vague forms to specific resistance. So the Freudian psychoanalysis, right? In the classical Freudian view, psychological problems arise from tension in the unconscious mind by forbidden impulses and threatening memories, right? So usually, remember, he's always referencing something, some kind of sexual desire. It's always these forbidden impulses that you have that you had to suppress. Psychoanalysis therefore probes the unconscious in an attempt to bring these issues into the light or into consciousness. The major goal of psychoanalysis then is to reveal and interpret the contents of the unconscious mind. That is key right there, that last sentence. Right, so you have these unconscious desires, conflicts that's driving you to do certain things, and if you bring that to light, then you won't have those disorders anymore. In the final stages of psychoanalysis, patients learn from their relationship with the therapist mirrors the unresolved issues they have with their parents, referred to as transference. Theory believes that people will recover when they finally release from the repressive mental restraints established in the relationship with their parents during an early childhood. The Neo-Freudian psychodynamic therapies. All right, so remember the Neo-Freudians, those are the psychoanalysts that broke away from Freud. So Karen Horney, Carl Jung, and Alfred Adler. So these therapies were developed by psychologists who embraced some of Freud's ideas but disagreed with others. And so mainly they believed in the unconscious conflicts, but they just believed it was about something else and not about sex. So while they follow many of the same techniques, their emphasis is on the conscious rather than the unconscious mind. Basically, they spend less time probing for hidden conflicts and repressed memories. So here's a nice little flow chart if you're getting a little confused about all the different psychotherapies out there. So, we have psychotherapy, we have behavioral therapies over here, and that can be broken down into therapies based on operant conditioning, therapies based on observational learning, and then therapies based on classical conditioning. Now over here, the insight therapies that we're talking about today, We have the psychodynamic, which, you get the psychoanalysis and neo-Freudians, and then humanistic and cognitive, which we're about to talk about. So first, humanistic therapies. Many people struggle with the problems of everyday existence. These are commonly called existential crisis. This term underscores the idea that many problems deal with questions about the meaning and purpose of one's existence. Humanistic psychology developed theories to specifically address these problems. Humanistic psychology believes that people are generally motivated by healthy needs for growth and psychological well-being. Remember, we've talked about before, humanism is the most positive of all the approaches or perspectives, right? It's all about growth, becoming a better person. So problems only occur when conditions interfere with normal development and produce low self-esteem. These therapies then try to help clients confront their problems by recognizing their own freedom and enhancing their self-esteem and realizing their fullest potential. All right, so remember we talked about how Carl Rogers calls that fully functioning and Maslow calls that self-actualization. So the client-centered therapy, all right, developed by Carl Rogers, he believed in therapy called for unconditional positive regard of the client by the therapist with the goal of helping the client become fully functioning. If you remember unconditional positive regard, that means where you accept them no matter what, right? If you're going to be their therapist, they might say a lot of crazy things. You have to accept what they're going to say. It's not necessarily up for you to judge them. You're trying to help them, become a better person, personal growth, be the best person they can be. So he places the responsibility for change on the person with the problem. That's it. That's very key. All right. So he uses the term client rather than patient to highlight the more active and equal role the person plays in therapy. All right. So it's not just the therapist telling them, "Oh, this is what's wrong with you." They want the client to take a more active role. Where a Freudian view is, you lay on your back, you say everything that comes to your mind, and then the therapist will be like, oh, that looks like it comes from this, or, this is your problem, or whatever it might be. So Rogers' belief, signs of discomfort arise from conditional positive regard, right, where there's conditions to your love. Therapists try to understand client's point of view, right, so they are non-directive. They don't do suggestions. They just reflect on the client's statements. So if you remember, we talked about this, earlier in the year during the personality unit, how they focus on being genuine, showing empathy, and having acceptance, which is that unconditional positive regard. So what else? Active listening. That is a very big part of Rogers' therapy. So Roger was concerned with the process rather than the stats or the outcomes. So the lasting contribution about therapists, warmth and understanding. And so he in his therapy, the clients and the therapist are face to face, unlike the Freudian method, the psychoanalytical method. He believed in active listening, showing empathy for the person. You see that picture there? That's a picture from one of the greatest movies of all time, Good Will Hunting, right? Young Matt Damon there, Robin Williams, and Robin Williams is his therapist, and he's doing a lot of these techniques, as he's trying to help Will work out some of his problems he had. Gestalt therapy is a part of humanism. So this emphasizes the wholeness of the personality and attempts to reawaken people to their emotions and sensations in the here and the now, right? So we talked about, humanism really focuses on the present, where psychoanalysis focuses on the past. Fritz Perls began as a psychoanalyst, but turned against Freud, saying Freud invented the couch because he could not look people in the eye. So Gestalt therapy emphasizes the here and the now and the face-to-face confrontations. right? So he didn't believe laying on your back on the couch and saying whatever comes to your mind, and that has all this meaning to it. He believed in the face to face, look someone in the eye, focus on the present. So Gestalt can be conducted with individuals or groups. The therapist is active and directive, and the emphasis is on the whole person. Remember, we talked about Gestalt earlier in the year, and that, Gestalt means whole, right? So it's all about the whole person. So in Gestalt therapy, the therapist awakens people to the sensory information they have been ignoring. Speaking in active voices, the therapist reminds clients that they alone are responsible for their feelings and ultimately their lives. Once again, putting responsibility back on the client. Empty chair technique. So this is a technique that you should know from the Gestalt therapy that's used in Gestalt therapy. So in this technique, clients ask to speak to a part of themselves they imagine sitting in the chair. So literally you put an empty chair in front of you, and then the clients are told to speak to that empty chair, but pretend it's a part of them, right? They become aware of inner conflicts, they gain insight and become more genuine by doing this. So usually it's that part of you that you're trying to hide. And so you put that chair there and then you talk to it. And hopefully you bring out those issues that you have. So humanistic versus psychoanalysis. So in a stark contrast to psychoanalysis, humanistic therapists assume that people are generally good and healthy, but can be negatively affected by pressure from oneself and society. Humanistic therapists accomplish treatment through genuineness, empathy, and unconditional positive regard and acceptance for their clients. Cognitive therapies. Cognitive therapies see rational thinking as the key to therapeutic change. The assumption is that psychological problems arise from erroneous thinking. So cognitive therapists help individuals confront the destructive thoughts that support depression. All right, so cognitive means thinking. So if you have, some psychological disorders, it's all about the way you think. So it's all about changing the way you think about things.